everyone, and welcome to the first episode of Coffee with Dr. Bhooma. Hello, ma'am. I hope you're well.
Hi, yeah, I'm good. How are you?
I'm fine as well, ma'am. So, I'll be shooting up some questions to you. Like these are some common concerns of our students as we all go through some stressful situations in life. And at what point should actually someone seek help? Or I should say that what can be the signs of distress where I should or someone should seek a counselor's help. And when I'll be seeking that help, just the last part, that won't that counselor be judging me in these situations?
Very pertinent question. When should a person seek professional help? Will the counselor not be judgmental? Yes. And let me clarify. See, counseling is reaching out to someone in a very professional way, listening to someone's problem in an empathetic way with all the concerns, and it is to reach out to person in terms of distress. But can I reach a counselor anytime? All of us, see, life is difficult. All of us do undergo the ups and downs in life. And there are situations where we have been trying to manage, but it becomes very overwhelming. What are the signs of distress when a person has to seek help? When the number one point, when you feel the need to be understood in a non-judgmental way. Yes, there's a need to be understood. You could approach your parents, you could approach your peers. However, seeking professional help is something different, and you could do it more confidently because you are not going to be judged. It's going to be, we are going to empathetically listen to you with attentive listening and help you in the self-exploration process. Next, number one is need to be understood. Next, you suffer from unusual anxiety, depression, stress, and confusion. What is anxiety? Anxiety is the worry about the future. What will I get my placement? Will I be able to perform well? Well, it becomes the worry about the future becomes so overwhelming that you start there. It manifests in the physical form. You start sweating a lot more than usual. You start shivering. There is sleeplessness. There is disturbance in your routine, or there is a signs of depression. Signs of depression, a sense of hopelessness, helplessness, change in appetite, change in sleeping pattern, all days, every day for more than 2 weeks. If that is going to happen, see, it can happen. Your low mood swings can happen. However, if all these signs are going to be persistent on all days, every day for more than 2 days, 2 weeks in a 2 weeks continuously, you should definitely seek professional help. You observe. The third one is you observe frequent change in moods or behavior, which is inconsistent with your normal behavior. No, last month I was okay. For last 1 month, I have been facing this mood swings, and it is not befitting my behavior. I know I'm not the person to behave like that. Then next is that frequent headaches, or you have back pain. These are called psychosomatic diseases. You have a lot of stress, anxiety, or something is working in you. It is manifesting in the physical form like frequent non-stop headache or your back pain. And then there are some relationship issues. You incline to use drugs, alcohol, or substances. Or you could have some career related issues, or you could have relationship issue, not necessarily with your boyfriend or a girlfriend or some issues. Yes, we are available for that. The relationship with your professor, and the relationship with your teammates, with your batchmates, even then you can consult a professional counselor. Then you have the memory and the retention related issue. There are issues relating to memory. You're not, if you're studying a lot, you're studying hard, but you're not able to recollect, you're not able to focus, you're not able to hold on to your studies. The attention span is just frequently going off. These are the signs where you should seek professional help. The next question is, yes, I have a counselor available in the institute. I want to seek help. However, I feel scared. Would I be judged? Would the counselor judge me? I have too personal issue, which probably is related to anxiety. And it is too personal. I haven't shared with anybody in my life, but I know it has reached a point where I need help. But can I reach a counselor? Would she or he judge me? Counseling is on based on a very, very safe environment wherein the counselor don't judge you on the basis of the severity of your trauma, on the severity of the symptoms, or the severity of your issues. Like it is like you go to a doctor with a fracture or you go with an infection. Does your physician judge you? No. Similarly, you can be sure that the counselor or the professional psychologist is not going to judge you. This is being this. We have a therapy called the Carl Rogers, wherein it is unconditional positive regard, whoever you may be, however, whatever your issue could be. We are not going to be judgmental and be critical of things. It is a very safe place wherein you can vent out and you have somebody to empathetically listen to you, give you the attention, give you that listen to you and be and in the process be your well-wisher, help you in the journey, explore your own niche of your self-exploration process, and help you with the assist you with the coping skills. Thank you. I hope I have answered your question.